Good morning, everyone. Welcome to our first progress report. My name is Melinda Antal, and in my thesis, I would like to discuss the optical and mechanical properties of dental ceramics. Allow me to introduce myself quickly. I'm a fifth-year dental student and a first-year MD-PhD student here at Semmelweis University. My supervisor is Emese, my SMS is Cindy. My vision would be to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists a guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other, since both of them investigates a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the method of a systematic review and meta-analysis. Over the past 35 years, CAD/CAM has become an increasingly useful technology. It basically allows you to print all ceramic restorations even in your own dental office, and these restorations have to be available everywhere in order to satisfy the emerging aesthetical needs of patients. When talking about this method, the manufacturing is mostly milling. Milling, or subtractive manufacturing, is precise and widely available, but it has some big flaws. Just to highlight some important flaws, it wastes a lot of raw material that cannot be recycled. It is really expensive, and it causes the wear of the milling tools. Recently, a promising technique has emerged in literature, which is printing. Printing, or additive manufacturing, has big potential because it could overcome the disadvantages of milling. For example, it can create complex geometries even with fine details, it doesn't waste as much materials, and it gives you finished surface, resulting in less post-production. It is also cheaper, so overall it is more cost and time effective. Just to highlight this with an example, from the price of one milled crown, you could get even more than 30 printed crowns. So as we see, printing has really big potential, but mechanical properties are the most important when a new material is introduced. If we want to see if printed materials could overcome milled materials, we have to be sure that they are at least as strong as milled materials. This is why I think mechanical characteristics are really important to investigate, since they help us predict the performance of a restoration. This is why my aim would be comparing the mechanical properties of additively versus subtractively manufactured dental ceramics. Here you can see my clinical question, which would be, do mechanical properties of dental ceramic differ when produced with additive versus subtractive CAD/CAM manufacturing? My population would be dental zirconia. I would like to compare additive manufacturing to subtractive manufacturing. My primary outcome would be flexural strength, and my additional outcomes would be Vickers microhardness and weighball characteristics. My hypothesis is that additively and subtractively manufactured dental ceramics have similar mechanical properties. My clinical implication would be really simple: to provide patients better and cheaper restorations under shorter time. Here you can see the details of my systematic search, which I conducted on the 10th and 11th of November in 4 databases. In my first key article, they compared milled and printed zirconia in a standardized way, and they also performed a well-buoy analysis next to flexural strength, but this study has the narrow focus, only investigating 2 brands of zirconia. My second key article also measured in a standardized way and performed Vickers microhardness test next to flexural strength measuring, but it is a pilot study. My third key article had similar strengths and limitations as my first key article. I would highlight that all of my key articles are ranked as Q1, which I think gives a strong basis to my research. After duplicate removal, I had more than 4,000 results, and I could narrow it down to a little bit more than 200 articles after the title abstract selection. Here you can see the progress regarding my first project. I just started full text selection. It is going slowly but surely. And allow me to move on to my second project, in which I would like to investigate the effect of material aging on the color stability of dental ceramics, also using the method of a systematic review and meta-analysis. As I said, with the introduction of improved restorative materials and fabrication technique, this changed the aesthetic restorative treatment patterns and resulted in a higher demand for aesthetics in dentistry. This led to the worldwide spreading of the ceramic restorations, which can successfully mimic dental structures. Zirconia, as I said, is one amongst the most popular dental ceramics since it has excellent mechanical properties. And with the introduction of more translucent versions, they can also be applied in the anterior region, giving really good aesthetical results. But whenever we place zirconia into the harsh environment of the oral cavity, it ages just like every other dental material, and aging can affect color. And since patients care mostly about the appearance, I think that color stability is a crucial factor to determine during the functional lifetime of a restoration. This is why my aim is to investigate the color stability of dental zirconia. This leads me to my clinical question, which would be, does aging of dental zirconia affect its color stability in vitro? My population would be dental zirconia again. I would like to investigate thermocycling, mechanical and chemical aging. I would compare it to the material before aging, and my outcome would be color difference. My hypothesis is that the aging of dental zirconia does not affect its color in vitro. My clinical implication would be also, again, really simple, to provide patients long-term aesthetical restorations. Here you can see my preliminary search that I conducted in 4 databases. Here you can see my 3 articles that are investigating the effect of thermocycling, toothbrush simulation, chewing simulation on the color stability of zirconia. During my preliminary search, I have found 2 previous meta-analyses and no Prospero registrations. Here you can see the progress regarding my second project. I gave myself a great check mark because I'm positive that my topic is feasible, but we haven't consulted with this about statisticians yet. Here you can see the summary of my project investigating the mechanical and optical properties of dental zirconia. And allow me to appreciate your attention with the wise words from Oprah: failure is a great teacher, and if you are open to it, every mistake has a lesson to offer. Thank you so much.
Regarding your first project, I would like to ask, maybe you know if there are printed ceramics available in Hungary nowadays?
Thank you for your questions. This is, as I said, a really novel technique. So printed materials are, printed ceramics are not available in the European Union. So we can apply printed ceramics only in the United States. We can apply them in the clinical practice. So mostly we can only print zirconia or lithium disilicate, and they sadly are not yet available here in Hungary, but they will be, I'm really sure, soon. Thank you so much.
You mentioned that if you do 30 printed crowns, wow, you can get just 1 milled crown. What does that mean? Like, how do you mean? Is it the same time, or what do you mean exactly by that?
So this price was only based on the material price. So my supervisor and her colleagues made a database of the average of the price of the material regarding printed materials and milled materials, and it is not the price that you can get in a dental office, it's just the price regarding the material. And because milling wastes a lot of material, it is much more expensive to produce milled crowns than, for example, printed crowns.
In your second study, you are talking about the color. So there are 2 aspects of this that you already see a bit of the literature. That one is that does the way of measurement of the color affects actually the outcome, because it might be an important factor that in different studies are actually they measure that in different way.
Yes, thank you for your question, Professor. In the studies, they always measure color difference with spectrophotometers, and since it is a really objective way of measuring, it gives you really good data about the colors, so I think that they are feasible with each other.
Yeah, the other question is that, I mean, this is in vitro, and
Yes.
in vivo it could be different actually, because in the mouse the saliva is there and many other things are there, and also, I mean, the factors which are coming with the food and drink. So it may actually kind of make some differences.
Yes, yes, I'm sure that it differs. There are some studies also using artificial saliva, but of course it's not the same as in mouth. But we are planning to do a clinical investigation like this, so I hope that we could see and investigate these results in vivo as well. Thank you so much.